Might expect the study has attracted plenty of criticism. One critic is fertility specialist and the medical director of Genea, Mark Bowman, who's just joined us now in the studio. Mark, thanks for coming in this morning. There is a sense with this study that, you know, IVF is being overused. Obviously, you wouldn't say that yourself. Let's just clear up what this study looked at. I understand it's about these unexplained infertility.
Well, this study is really looking at and questioning what is the best management overall for couples with this rather interesting problem of unexplained infertility. And it's actually fairly common. It's about 25% of couples that we will see have all of the investigations for fertility undertaken. No obvious cause is found, and we would call that unexplained infertility. And so there's a debate about how long should those couples try on their own, and then if they are going to move to treatment, what is the best treatment for them?
Because this was an international report, so it's not actually looking just at Australia. But in Australia, are there more people now seeking IVF?
Well, there's certainly more people with a problem of infertility because we tend to leave it a bit later in life, and we know that female age is very important. But what is interesting in the statistics about the business of getting pregnant is that those couples that are destined to conceive on their own, irrespective of age, will tend to do it in the first few months of trying. And progressively, the people are more likely to get pregnant on their own keep, if you like, leaving the equation. And it's been well shown in studies that by about 18 months or more, the actual chance of getting pregnant on your own, even if all of the tests are normal, is now dropping to exceedingly low levels. And, you know, this study is sort of saying, well, that's all very well, but perhaps those people have been trying for 18 months to 2 years could really try for 3 to 4 years. And that is really, I would argue, an unacceptable approach to take when their background chance might only be a couple of % per month and the woman is getting older.
Yeah, how would those couples, particularly if you do tests and it shows that everything's normal, as you say, there is just that sense of, well, it's just a matter of time. What time would you put on it then?
Well, as I was saying, what those stats that I was talking about suggest that the chance to conceive is not linear. It's not that it keeps going up, and if you keep trying, eventually it will work. And there is a secondary problem that as women get older and older, it gets hard to do. So really, those what they call cumulative pregnancy curves show that very few people are getting pregnant on their own beyond about 18 months to 2 years. It starts to become a very flat curve, and pregnancies that do occur then are very sporadic. And if you tell a 35-year-old woman that, oh, well, look, you'll just wait for another 2 years, and then she's 37, 38, when her own eggs are in decline, because women are born with all their eggs, I don't think that's a very appropriate treatment. I don't think it's particularly ethical either.